Hi, this is Paula Eggleston from the Charleston area League of Women Voters, and today we have Bobbi Jo O'Neill, who is running as Charleston County Coroner. Her opponent in this race declined to participate in the candidate forum, and so we offered Ms. O'Neill the opportunity to have a discussion with us about the issues related to the county coroner candidate position. So the first thing that we're going to do today is offer Ms. O'Neill as Charleston County coroner candidate the opportunity for a 60-second overview of her platform. Ms. O'Neill?
Yes. Well, first of all, thank you to the League for inviting me to participate. The Charleston County Coroner's Office is a very important elected position, and we impact citizens and visitors of Charleston County every day. I've been honored to serve Charleston County as the Chief Deputy Coroner for 20 years. I have been investigating deaths almost my entire career. I started off as a registered nurse in forensic nursing, taking care of emergency room patients and sexual assault victims, and helped create the sexual assault team for the medical university, which is where we took care of victims of crime and sexual assault victims, not only from a health perspective, but also from a forensic science perspective. And so during my tenure, I've served all residents in all areas of the county in all areas, from those deaths that have occurred in the privacy of individuals' homes due to natural causes, due to more tragic events, which are car accidents and suicides and drug overdoses that have impacted families. Things that you don't think about is deaths on the container ships and cruise ships that come to town, and on the Air Force Base. The coroner's office has responsibility for those. And I have the unfortunate distinction of having handled some of the largest tragedies that have impacted Charleston County, to include the Sofa Superstore fire and the massacre at Mother Emanuel.
Okay, thank you. We're going to move in to our first question. And please tell us, what are the necessary qualifications for a Charleston County coroner to perform his or her job effectively?
Very good. Well, great question. I have been serving in this capacity, like I said, for a long time, and we've been working to improve the qualifications for medical legal death investigators for many years. Forensic science has really changed over the past 10 years. If you've been watching CSI and those types of shows, things have changed a lot. And our state legislature actually passed a law a number of years ago stating what the requirements are to run for office in Charleston County. And that includes having a certain degree and years of experience, or you could be a physician, or you could be a registered nurse, or you could be a law enforcement professional, or having taken criminal justice programs that were approved by a training council. And so I'm fortunate to meet a number of those requirements. I will say qualifications in this specific position are very important as we speak for people who can no longer talk for themselves. To make sure we determine how and why they died. And you have to have a medical background, and you have to understand the legalities of the decisions we make.
All right, thank you so much. All right, we're going to move on to the second question. What is the greatest issue facing the coroner's office? And if elected, how will you take on this challenge?
Yeah, well, the greatest issue right now is actually a national issue. And there is a shortage of forensic pathologists, and those are the physicians who do forensic autopsies. And for whatever reason, physicians are not going into that practice. And so we have a shortage happening across the country, including here in Charleston County. And what that means is that it takes longer to get an autopsy. Families are having to wait longer. Funeral service providers are having to wait longer to take care of those individuals. And law enforcement is waiting for the results from those in order to make decisions as to placing charges and so forth. But the coroner's office was very visionary. A couple of years ago, we saw this problem coming down the line, and we started preparing for it. And we sought grant funding and built out our own forensic autopsy suite at the coroner's office. And because of that, we've been able to bring in a board certified forensic pathologist who is currently working just for the Charleston County Coroner's Office. We have some of our autopsies are also completed at the medical university, but there's a backlog there because a lot of the counties around us and other jurisdictions are coming to Charleston for those services. So by having it in-house, we're taking care of the problem within Charleston County and serving our own in a really timely and effective manner. So that's the biggest issue that's really facing us right now.
All right, thank you. What would you say is the primary responsibility of the county coroner?
Well, the state statute is really specific about that. The responsibility for the coroner is to investigate deaths within a certain jurisdiction, to speak for the person who died and as extension of that, their family, in order to determine the cause of death and the manner of death. And, let me give an example of what we're talking about. So we handle everything where someone dies outside of a hospital setting. Again, regardless of where that's located, in a private home, on the roadway, on a cruise ship, or wherever that may be. We're also responsible for everything that occurs inside a hospital where they've been there less than 24 hours. And then also anyone who's died inside a hospital, but they died after 24 hours, but not from natural causes. And then we also authorize all the cremations that are occurring in Charleston County. So if you are wanting to have your loved one, the disposition of cremation, the coroner authorizes permits to make sure that no one is cremated before an investigation is handled. And so that's another big responsibility of the coroner's office.
All right, thank you so much. And question 4, how does your management style complement the running of the coroner's office?
Well, that's a great question because the office really requires 2 responsibilities. The first is that they must be a lead medical legal death investigator. That is the role of the coroner per the state statute, is they are the death investigator. But they also have to be an administrator and a manager. And having been in the office for 20 years under the 2 prior coroners, Susan Cheating and the current coroner, Ray Wooten, I've had a hand in hiring and recruiting all of the personnel, managing the facilities, and operating the budget. And to date, I've brought in just under $1 million in grant funds to Charleston County to improve forensic science services. So that's recognizing where the needs are, what we can do to better serve our community, but then also manage the facilities that we have. Charleston County really blessed us a couple years ago as they moved us into a freestanding building to better serve decedents and their families. And all the agencies that we manage. And so being able to do both of those, investigate and be that lead investigator, but also be able to manage the facilities, the personnel, and the budget, which I've had a hand in for a long time.
Great. All right. And now, Ms. O'Neill, if you would provide closing comments, you'll have 60 seconds.
Great. Well, again, I just really appreciate the opportunity to come and talk to you about the coroner's office. This is a place where I've served for a long time, as you've heard. And the reason is because I want to provide answers to families and speak for that person who can't speak for themselves. This is a position that I can assure everyone who's watching that if you need the services of the coroner, you or your family, your neighbor, your coworker, you are not going to be concerned with the political affiliation of the person who's handling that. You're going to want to know that they know what they're doing and have expertise in their field. We impact a lot of things. The decisions of the coroner can impact whether a family receives their life insurance or not. It can impact whether someone is charged for a crime or is not charged for a crime. We impact many, many things, and we impact people at a very personal level. And so to have someone who is qualified, who's experienced, who's compassionate, who understands what loss is like. I've been through tragedy myself and understand that. And so I just would appreciate that everyone take the time to understand this really important role. I hope we don't meet while I'm working, but please know that it is an important position that's elected.
Okay, we want to thank you for your time today. I want to put in a plug for the League of Women Voters. First, everyone vote. League of Women Voters is nonpartisan. And also, please go to 411vote.org for information about the candidates. We are glad that you were able to join us today, and we will sign off. Thank you so much.
Thank you, Paula. I appreciate your time.
Sure.